Thank you, Dr. Rue, for allowing me the time to speak and hijack part of your press conference and kind of give the community an update and be a little bit of a voice for my colleagues and explain what we're seeing on the front lines of this pandemic. We're almost 2 years into this, and it still feels like every day is a crisis when we go to work. The easiest way to describe that feeling is that we're sort of always feeling like we're waiting for the Jenga tower to fall, and we just never know when that's going to come. It's very defeating as healthcare workers, and I mean at every level across the region, to live almost in two parallel worlds. One where we go to work and kind of, as Dr. Rue said, kind of take it in the ring and get beat up a little bit. And then the outside world where society sort of feels like, oh, this pandemic is behind us and we're going on with our daily lives. I don't think it is behind us, and I expect that the numbers today will spell that out for us all, that it's probably worse than it was last year. And I want to tell you a little bit about what it's like and what we're seeing cases and how it is to go to work. This is not the kind of medicine that we wanted to practice, and this isn't the way that we want to take care of our patients. We want to do better, and we need your help. Our patients are seeing 10 to 20-hour wait times to be seen in the emergency department, and we're starting to practice waiting room medicine, which is something I never imagined I would see in my career. We're diagnosing perforated bowel and running CAT scans and doing lab work and any sort of test that we can from patients that are waiting for us in the waiting room. We're starting oxygen on COVID patients in the hallway, and those hallway beds are often double and triple bunked. And we're doing that because we're trying to make space to see more patients, as all of our inpatient beds and ICU beds are full. And I know our colleagues upstairs on the floors and in the intensive care units are feeling the burn just as much. We're seeing it on every level with staffing. The emergency department wasn't designed to be run with inpatient holds and ICU holds, and our nurses are powering through taking care of multiple critical patients all day, every day. And we're all, hoping that we continue to manage this because I have rock star colleagues that, when the next emergency comes in, we're still there and able to handle that. But this trickles down outside of our emergency department and outside of our hospital walls. Dr. Rue mentioned part of my job is as an EMS medical director, and so we're seeing this trickle down in the community as well. Our EMS providers are stacking up in the emergency department, waiting for beds as we're struggling to find room for patients. And so when you call 911, we want them to have quick turnaround times because we want them to be there for you. We don't want an ambulance to have to come from the other end of the county to make it to your emergency. Again, this is not how we want to be practicing medicine, and we need your help. We are begging you to get vaccinated, and the following cases are pretty illustrative as to why. I recently saw a young man in his late 20s who is 6 months post-COVID with a chest x-ray that looks like florid COVID. He's still on oxygen and may never be able to come off, and he's 28 years old. I recently took care of a married couple who refused the vaccine and had refused proven therapies that my brilliant infectious disease colleagues have vetted and designed protocols for us, and they both prematurely left their family members behind them. Young, vibrant people. We want to make these stories come to an end. We want to do our best to support each other so that we're not taking our turns crying in the med closet over unnecessarily watching patients die. So much of this is preventable, and that's really why we're asking for your help. This isn't something we normally do. This isn't an approach we normally take. I would say that this is unprecedented times, and we're all dying for some precedented times. But for right now, this is where we're at, and we need your help. Please, 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 if you are not vaccinated, ask a trusted healthcare professional. Get the information that you need to feel comfortable getting the vaccine. If you're eligible to get the booster, please do so. We need your help as much as you hopefully will not need ours. So thank you for the time. Thank you for listening. Please take these stories into consideration. I'm going to turn it back over to Dr. Rue.